Good afternoon, everyone. Thanks for joining. My name is Chris Williams. I'm the Congresswoman's Director of Outreach here at the District Office, and I'll be your host for this program. We're excited to share information with you regarding the open enrollment process for Medicare, which begins October 15th and ends on December 7th. I just want to cover a few things before we begin and hand it over to our panelists. If you have a question, we're going to do Q&A towards the end. You can use the chat box on your screen. Our staff will be reviewing these questions, and we're going to get to as many as we can. If we do not have time for your question, we're happy to follow up with you afterwards and work with you to get an answer. Just to head off a common question we get, yes, we will share all the slides that you'll see today, along with some other helpful resources provided by the agencies. Please keep in mind this webinar is being recorded for the convenience of those who aren't able to join live. So if you just keep in mind any personal information you might share in your questions, it's best to keep it generic. With that, let's get right into our presentations. Joining us today are Jarita Walker from the Social Security Administration. She's going to be able to speak to Medicare Parts A and B. And after that, we'll hear from Adine Zephyrin with the Center for Medicare and Medicaid Services. She's going to cover Parts C and D. So with that, we're going to get started with Jarita. We do have some slides, so I'm going to share my screen here. And whenever you're ready.
Good afternoon. My name is Jarita Walker. I am a public affairs specialist with Social Security Administration, and I conduct outreach for Northern New Jersey. I would like to thank Congresswoman Sherrill's office and Chris Williams for allowing SSA to present to you today. The SSA presentation will cover the Medicare enrollment process. Next slide, please.
Go ahead.
Medicare is our country's health insurance program for people age 65 or older. People younger than age 65 with certain disabilities or permanent kidney failure or amyotrophic lateral sclerosis, which is Lou Gehrig's disease, can also be eligible for Medicare. You have choices to how you get Medicare coverage, Original Medicare and Medicare Advantage. Original Medicare includes hospital Part A and medical Part B insurance. If you want drug coverage, you can add a separate drug plan, which is Part D. You can also add a Medicare supplement insurance, Medigap policy to help you pay for your out-of-pocket costs. Medicare has 4 parts. First, Part A, hospital insurance, which helps cover inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. There is no monthly premium for Part E if you are insured for retirement benefits. The 2025 deductible for Part A is $1,676 for each inpatient hospital benefit period. Second, Part B, medical insurance, which covers 80% of doctor bills and other outpatient medical expenses after your first $257 in approved charges. The 2025 standard monthly premium is $185 per month. After you retire, your health insurance may require for Medicare to pay first. Many supplemental plans require you to sign up for Medicare Part B. The Medicare premium most beneficiaries pay requires a quarter of the actual cost, and the federal government covers the balance of the cost. Third, Medicare Advantage, also known as Part C, is an all-in-one alternative to Original Medicare. These bundle plans include Part A, Part B, and usually Part D. These plans may also have lower out-of-pocket costs and may offer extra benefits that Original Medicare does not cover, like vision, dental, and more. Fourth, Part D is prescription drug coverage, which covers a major portion of your prescription drug costs. Your out-of-pocket costs, monthly premiums, annual deductible, and prescription co-payments will vary by plan. You will enroll with a Medicare-approved prescription drug provider, not by contacting Social Security. Each Medicare Advantage plan can charge different out-of-pocket costs, but they must follow rules established by Medicare. Medicare-approved prescription drug plans cover a major portion of your prescription drug costs. Next slide.
Go ahead.
Medicare eligibility begins at age 65, even though the full retirement age has increased above age 65. One of the most important things to remember is that you can apply for Medicare online, even if you are waiting past age 65 to apply for Social Security retirement benefits. You should apply for Medicare 3 months before your 65th birthday, even when you plan to apply for your retirement or spouse's benefits later. If you are approved for Social Security disability benefits, you will be eligible for Medicare benefits 24 months from the month you are entitled to receive benefits, not from the first month you receive a payment. If you are diagnosed with amyotrophic lateral sclerosis, which is Lou Gehrig's disease, and you get disability benefits, you can get Medicare right away. If you have permanent kidney failure and you receive maintenance dialysis or a kidney transplant, you may also be eligible for Medicare. Next slide, please.
Go ahead.
Medicare has 3 enrollment periods. The initial enrollment period is a 7-month period that begins 3 months before your 65th birthday, includes the month you turn age 65, and ends 3 months after that birthday. If you apply during the 3-month window prior to the month you turn age 65, your Medicare is effective on the first day of the month you reach age 65. If you sign up during the last 3 months of your initial enrollment period, the coverage begins the month after you enroll. Next slide, please.
Go ahead.
General enrollment period. If you choose not to sign up for Medicare Part B, but then decide to do so later, your coverage could be delayed. You may have to pay a higher monthly premium for as long as you have Part B. Your monthly premium will go up 10% for each 12-month period you were eligible for Part B but did not sign up for it. If you don't sign up for Medicare Part B during your initial enrollment period, you have another chance each year to sign up during the general enrollment period, which runs from January 1st through March 31st. Your coverage starts the first day of the month after you sign up. Next slide, please.
Go ahead.
National enrollment period. You may have medical insurance coverage under a group health plan based on you or your spouse's current employment. In this case, you may not need to apply for Medicare Part B at age 65. You may qualify for a special enrollment period. If you apply online for Medicare Part A only and refuse Part B, which does have a monthly premium, you can enroll in Part B later, anytime you are still covered by your employer's group health plan or within 8 months after your coverage or employment ends. Always remember, you can file for Medicare if you are delaying cash benefits. Next slide, please.
Go ahead.
If you are already enrolled in Medicare Part A and later you want to add Part B, under the special enrollment period, you have 3 options. You can always visit the website at the ssa.gov/Medicare to complete the online application. You can fax the completed CMS 40B, which is the application for enrollment in Medicare Part B, and the CMS L564, which is the request for employment information, along with any proofs to your local Social Security office. And lastly, you can also mail your completed forms to the local Social Security office. Next slide, please.
Go ahead.
You may be able to get help from your state to pay for Medicare premiums through the Medicare Savings Program. If you qualify, the program may also pay Medicare deductibles and coinsurance. To qualify, you must have limited income and resources. When you apply, your state determines which programs you qualify for. You can go online to get more information about these programs on Medicare's cost webpage at the medicare.gov/basics/cost. Next slide, please.
Go ahead.
Extra help is available for beneficiaries with limited resources and income to help pay for the costs related to a Medicare prescription drug plan. These costs include monthly premiums, annual deductibles, and prescription co-payments. Extra help is estimated to be worth about $6,200 per year. You may apply for extra help online, over the phone, or with an appointment at your local Social Security office. Next slide, please.
Go ahead.
People with higher incomes will pay more for Part B and their prescription drug plan premium. This is called Income-Related Monthly Adjustment Amount, which is IRMA. We determine whether you pay the higher premium every year. This graphic shows the Medicare Part B and Part D premium amounts for each income bracket. Most Medicare beneficiaries pay the standard premium for Part B, which is $185 per month in 2025. It is automatically deducted from the Social Security check if they receive one. If they are not receiving a monthly Social Security check, they can be billed or have their premium deducted from a checking or savings account. To decide your IRMA, we ask the IRS for your modified adjusted gross income, which is the MAGI. That equals your adjusted gross income plus certain tax-exempt income from the federal income tax you filed 2 years ago. For example, the 2025 Part B premium is determined by your MAGI on your 2023 tax return. If your 2023 tax return is not available, we will use your 2022 tax return. Next slide, please.
Go ahead.
If you are a higher income Medicare beneficiary, but you have had a major life-changing event, for example, if you stop working or you have reduced your work and your income has decreased, you may ask Social Security to make a new determination on your premium. You can use this form SSA 44 and provide proof of the life-changing event. Next slide, please.
Go ahead.
Please keep in mind that although you apply for Medicare by contacting Social Security, and we have some Medicare information on our website, it is another federal government agency. Centers for Medicare and Medicaid Services, commonly referred to as CMS, administers the program and is your main source for information regarding Medicare. Social Security helps you apply for Medicare Parts A and B, and we send your entitlement information electronically to CMS. You can also take your application for extra help with Medicare Part B. If you sign up for Part B, we deduct the premium from your monthly Social Security benefit and send it to CMS before you receive your payment from us each month. If you enroll in Medicare only, CMS will bill you for your Part B premiums until you go on Social Security. If you have any questions regarding the Medicare program, you can call the 1-800 number, 1-800-633-4227, or visit the website at medicare.gov. Next slide, please.
Go ahead.
Medicare has a free, secure online service for accessing personalized information about your Medicare benefits and services. You can create an account at medicare.gov to get started. After you can create an account, you can fill out the initial enrollment questionnaire, view claims information, get quality information about your providers, and more. For more information or help with the site, please contact Center for Medicare and Medicaid Services, which is the 1-800-633-4227, or you can always go to the website at medicare.gov. Next slide, please.
Go ahead.
You can always visit SSA's website for current information concerning our programs and services. SSA continues to add content and encourages you to conduct business online. Next slide, please.
Go ahead.
Here is my contact information. If you need any assistance with any SSA matters, please do not hesitate to reach out to me. Thank you so much and have a great afternoon.
Thank you so much, Dorita. That was really helpful. Just a reminder to folks, if you would like to leave a question, we are monitoring the chat box, so you can leave your question there. We're going to get those towards the end of the presentation. In the meantime, up next, we have Adine Zephyrin from the Center for Medicare and Medicaid Services, and she's going to go over Medicare Parts C and D. Adine, it's all yours.
Thank you, Chris. I'm going to go ahead and share my screen. One moment, please. Yeah. Okay, you can see it clearly, Chris?
Yes, we can.
Okay, so my name is Edine Zephyrin, and I am an outreach specialist at CMS New York. We represent New York, New Jersey, Puerto Rico, and the Virgin Islands. Thank you for Rep. Sherrill for inviting CMS to this webinar to speak to you about Medicare Part C and D. I'm blanking out. How do I go down again, Chris? Out here.
You should just be able to swipe or arrow up or arrow down.
That's what I thought. For some reason, I'm not seeing it right now. So this is about safe case. One moment, please. There it is. This is the button right here. Okay.
Yep, that works.
Right. The button I couldn't see. Okay, so let me go to part 2. This information is current. This is basically just saying that this information I'm telling you right now is current as of right now. So as you know, laws change, rules change, guidelines change. So if by next month, during the open enrollment, something changed, we will be more than happy to share that, and Chris will be more than happy to share that with you in turn. But this is all this is saying. You've heard from my colleague at SSA about Medicare Part A and B, and now I'm going to speak to you about Part C and D. But before I start, there is one more thing that we need to speak about, that is about Medigap. So Medigap is basically when you have what we call original Medicare. You'll hear people saying about old Medicare, original Medicare, or just Medicare. All it means is that you are getting your benefits from Medicare directly from CMS. And because original Medicare is Medicare Part A, your hospital, and Part B, your medical care, you might be interested in purchasing a Medigap policies. And as the name implies, it basically, that's what it means. It means that the Medigap policy will pretty much cover what original Medicare doesn't cover. And the open enrollment period starts when you're 65, but it is you must understand that you have to have Medicare Part A and B in order for you to purchase the Medigap policies. You cannot just purchase a Medigap policy without having Medicare Part A and B. You can buy it at any health plans that offer Medigap policies, and it is strictly a private health plan that you are purchasing. We, CMS, don't have any authority over them, so any contract is between you and that insurance company. But the Medicare policy is available to you if you want to purchase it in order for it to for instance, cover your copay, your co-insurance, your deductible. That's what it's for. So the Medicare Part D, also called Medicare prescription drug plans, is something else that you can purchase. In order for you to have Medicare Part D, you have to have either Medicare Part A or Medicare Part B, or Medicare Part A and B. You cannot just buy a Medicare Part D separately on its own. You must have Medicare Part A or B or both in order for you to be able to get a Medicare prescription drug coverage. It is also run by private companies. So when you go and you buy it from any of the health insurance companies out there, you're purchasing from a private company, and the rules and guidelines and that they have is what you're going to follow. Our job at CMS, when you purchase a Medicare Part D, is to come in if, for instance, that specific insurance say these are the benefits if you purchase that Part D, and it's written, it's in your book, you know that's what is there. And for any reason they were to deny a claim that you know was part of your is part of your plan, then that's the part that where we would come in if you come to us to make sure that that you are provided with that benefit that they agree to provide when you purchase that Part D. So again, it's run by private companies, not by CMS. You can purchase it. You have to have Part A or B or both in order for you to have Part D. What are the requirements? As I said, A and B, you must live in the plan service area because again, it is private, but you must live in the plan service area. You must enroll in a plan to have Part D coverage. You cannot live outside of the service area. You cannot live outside of the United States, and you cannot be incarcerated. Those are the requirements. The cost in 2025, obviously, there's a cost. When Chris share my slides with you, you'll see it. But remember, we are talking about open enrollment that's happening next month, which means for 2026, whatever you see here will most likely change. So that's just to tell you about what 2025 was. If you already a Medicare beneficiary, you have a drug plan, you're probably familiar with that, but that's just 2025. For 2026, we don't have the numbers yet. That is why I cannot give them to you. But as soon as the numbers are available, there are several places you'll be able to get that information. One of them will be directly from your plan. Income folks will pay higher Part D premium, and you must pay if you have a Part D coverage. This is part of the requirements. There is also something called IRMA, that's income related monthly adjustment payment for Part D premium. For 2025, this is the numbers you're looking at. 2026 also will be different. So individual, if you're married, etc., the numbers that you see on that slide is for 2025. 2026, it will be different. But just so you know, the more money you make, the more your premium is. So that's all IRMA stands for. It's an income-related monthly adjustment amount based strictly on your income. That part is very, very important. Please remember, there is such a thing as a late enrollment penalty for Part D. What does that mean? It means when you are eligible to enroll in a Part D plan, you must enroll in a Part D plan. There's only two reasons you would not pay a late enrollment penalty. The first one is if you have what we call a creditable drug coverage. A creditable drug coverage is simply that you were covered by a drug insurance plan that is as good as or better than what we offer, what we Medicare offer. So better, as good as or better than what we offer. And of course, it has to be from a health plan that is part of a group health plan, and etc. But what you need to remember are those two things. Creditable drug coverage, if you had it, it had to be as good as or better than what Medicare offer, and you had and your coverage continues up until you enroll in the Part D. The second part is if you receive extra help. What is extra help? It's as simple as it's literally based on income. If your income is low enough, then you apply. When you apply for Part D, then the extra help with your state can help you with that. Those are the two reasons only that you will not pay late enrollment penalty for Part D if you were eligible and you did not enroll. And that eligibility is exactly what you see on your screen right now. It's 1% for each full month that you were eligible and without creditable drug coverage that you could have enrolled and you did not. It is important, please, you remember that, because once you incur a late enrollment penalty, it does not go away ever. Ever. So what that means is for as long as you have Medicare Part D, you will be paying that late enrollment penalty. So this is why it's very important that when you are enrolling in Part D, you enroll, when you're eligible for Part D, that you do enroll in it, unless you have those two conditions, those two reasons I said, creditable drug coverage or you receive extra help. Should you enroll in a Part D? Again, you must, unless you have creditable drug coverage or you receive extra help and you're eligible, you must enroll. That slide will tell you if you have creditable drug coverage, what it is, and if you don't have it, etc. But again, you must enroll when you're eligible, otherwise you'll pay a late enrollment penalty. And that late enrollment penalty does not go away. Now we will talk about Medicare Part C. Medicare Part C, the simplest way to understand it, this is you buying a Medicare-approved private health insurance, again, by private insurance. So this is you purchasing from a Medicare-approved private health insurance, and they in turn will be giving you the benefits of Part A, Part B, sometimes Part D. So you could have a health insurance, also called Medicare Advantage, also called Part C, also called Medicare HMO. You'll hear several ways that people refer to it. All it means is it's you purchasing the Medicare to a private health insurance, Medicare approved private health insurance that will give you the Part A, the Part B, and sometimes including the Part D. So that plan that you purchase will give you all this. That's what a Medicare Advantage plan is. Oh, one more thing. For you to purchase a Medicare Advantage plan, you have to be enrolled in Medicare. What that means is you have to be enrolled in Medicare Part A and B. Then you can purchase a private health plan, Medicare Part C, to give you those benefits that you are purchasing. The requirements, you also must live in the plan service area. You must have Part A or Part B or both, and you can only belong to one Medicare health plan at a time. One Medicare health plan at a time. You must still pay your Medicare premium. The plan, some of them has 0 premium, some of them you could have premium, some of them can be premium that is very expensive, some of them more affordable, etc. But this is you going to make that decision to decide if you want your Medicare benefits to be managed by health insurance, then you purchase it. The enrollment period, my colleague from SSA talked a little bit about it, but I'll cover it just so you understand when we talked about initial enrollment period, annual enrollment special. So the initial enrollment period is the one that most people seem to be a bit confused about that. All it means is that when you become eligible to purchase Medicare, to enroll in Medicare when you turn 65, you have that 7-month period. So 3 months before the month of your birthday, the month of your birthday, and up to 3 months after the month of your birthday. Those are the 7-month period we're talking about when we talked about initial enrollment period. So 7 months when you turn 65, that you can enroll. 3 months before, 3 months after, and the month of. And then we have also some special enrollment period. There are different scenarios. more information is available on Medicare.gov. We also have the annual enrollment period. This is why Chris is having this webinar right now to cover that annual enrollment period, which starts on October 15 every year, same time, October 15 until December 7. And then we have the Medicare Advantage open. So when you look at that slide, it gives you an idea. This is something you can keep just to remember the dates once you enroll in Medicare. So that's what this is all about. This is specifically to tell you about all the resources where you can get more information, where you can get our books, etc. So that, of course, there's CMS, that's Medicare.gov, CMS.gov, Social Security, which my colleague covered. You can also, I cannot recommend them enough, but there is something called the State Health Insurance Assistance Programs. SHIP. So when you hear about SHIP, that's what it stands for. State Health Insurance Assistance Program. They are wonderful. They will have one-on-one with you and help you make the best decisions for you specifically. When you need to purchase a Medigap, Medicare Advantage, a Medicare Part D, and so on. So this is the information for that. By the way, if in New York, if you have friends, family, etc., in New York, the SHIP is actually called high cap, but it doesn't matter. When you go to shiphelp.org, the website, it can tell you exactly who to call, where to call in order for you make an appointment to sit with one of them. And again, one-on-one, great unbiased advice about you specifically, what works for you. We have the Medicare NU handbook. If you are already in Medicare, you are familiar with that. This is how you can order it. The SHIP again, this is who I was right there, shiphelp.org. That is the website where you can get more information. Please, if you need any help, they are there for that, and they are amazing. Before we finish, definitely that's something we need to talk about, fraud and abuse. We know that one group of individuals who are always getting fraudsters out there looking for them are our Medicare beneficiaries. So this will help you. You are the first line of defense against fraud. You're the first line of defense against abuse. When you see it, let us know. We will take action. We do not ignore any call, any mail, any email, anything at all. You go to your Congress person, they will send it to us. We will look at it. And if there is actions to be taken, we will take that. So fraud and abuse is definitely our first line of defense. Please report it. These are the do's and don'ts for you specifically to make sure
Dean,
that
can you make sure you're sharing your screen? I think it might have come off screen.
no, it says I'm still sharing it.
Okay, it might just be on my end. Sorry.
Okay. Yes, it says you are. Yes, I'm still sharing. Okay, so this is the do's and don'ts. Take a look about the things that you should do and the things that you should not do in order to protect yourself against fraud and abuse. This is, please, if you get a chance, absolutely give us your feedback, because we would love to know how we can serve you better. And this is my name and my email address that you can contact anytime. And Chris can also share that with us at any moment. And thank you again for inviting us. That is it. Thank you, Chris. Now I'm going to stop sharing.
Thank you, Dean. Yep, that was on my end. I apologize for that.
No problem.
Thank you for that presentation. So now we have time for questions. We'll get to as many of these as we can here. Let's see, our first one is from Jeff. I think we covered the first part here, but worth repeating. And then let's get to the second part too. So what is the age requirement to apply for Medicare? And what if your spouse is still working and receives their own health insurance? How does that work?
The age for Medicare. Oh, sorry. Go ahead.
Go ahead, Jarita.
The age to enroll for Medicare is age 65. And as far as your spouse, if she's still working and have health insurance through her employer, when she stops working, she can submit the special enrollment forms I discussed, which was the CMS 40B and the L564. The CMS 40B will allow her to tell us what month she wants Medicare Part B to begin, and the L564 is for her personnel department to complete, letting us know when her employment began, when her employment is going to end, when her health insurance began, and when her health insurance is going to end. And this way, we can have the Medicare Part B begin the month after she stops working. Hopefully that's helpful.
Adine, anything you'd like to add to that?
No, Jarita definitely has it. But let's remember that 7-month period that I told you guys about. If your spouse is not working, definitely remember those 7 months. You must apply during that time. Otherwise, you will incur late enrollment penalty.
Great. Our next question, I have two here that I believe are kind of getting to the same thing asked different ways. So Lou asks, is the decision to choose between original Medicare with or without Part C and Medicare Advantage a once in a lifetime decision? Phrased a different way, Robert asks, can you switch back and forth between original Medicare and Medicare Part C? Adine, can you answer that one?
Yes, definitely. It is not a once in a lifetime. For instance, again, this is why Chris is having this wonderful webinar for you. As of October 15, during that open enrollment period, you can switch from original Medicare to Medicare Advantage. You can switch from Medicare Advantage to original Medicare, and you can switch from Medicare Advantage to original Medicare with or without Part D. So this is the time when you can make any decision. Choose, not choose, what to switch, what not to switch, because, and it's a long time because we want you to pay attention to what you need. And we have it once a year specifically because we know sometimes you make the decisions. Because remember, everything is going to be effective as of January 1st, 2026. Whatever decision you make during that open enrollment, it's going to be effective as of January 1st, 2026. And then the next time you'll be able to change again will be during the open enrollment period. And during that time, you can choose and switch whatever you need to work for you.
Thanks, Adine. Jarita, anything to add to that?
No, she covered it. Thank you.
Beautiful. Our next question comes from Sue. Do any Medicare plans cover you while you're traveling outside of the US?
I think that's a Dean question.
Right. So that will fall. Medicare is for the United States, so it doesn't cover you overseas unless it's an emergency. There are very few circumstances where original Medicare would cover something overseas. That usually has to do with a cruise, depends on what part of the ocean you're in, etc. So that's for Medicare. But as a whole, original Medicare does not cover you outside of the United States. For Medicare Advantage, now this is something that you and the health plan. So this is something that when you're purchasing it, you have to figure out which health plan offers what and what exactly do they offer. And if you're somebody who likes to travel, you're retired, you like to travel, then if you are in a Medicare Advantage, I would definitely say look at which health plan offers what and then choose whichever one works the best for you.
Thanks, Adine. Our next question is going to come from Elsie. Can you have health insurance through your employer and Medicare at the same time? If the answer is yes, which insurance would be primary? I'm not sure which one of you this falls under, but
Okay, so as long as you're working and you have employer group health plan coverage through your employer, that is your primary as long as you're working. We recommend that you enroll in the Part A, which is the hospital coverage, covers 80% of hospitalization free of charge as long as you have what we call insured status, which means 10 years of work or 40 quarters of coverage allows you to have insured status. So as long as you're working, the group health plan coverage for the employer is the primary. Part A is going to be secondary. When you retire, it'll be the reverse. Medicare Part A and Medicare Part B will be your primary. Part B, doctor visits, covers 80% of doctor visits. It has the monthly premium this year of $185 a month. It's normally deducted from your retirement benefits if you are receiving them. If you are not, Center for Medicare Medicaid Services bills you quarterly for the Part B premium. And then whatever health insurance, if this is an option through your employer, you carry that health insurance into retirement, and it will cover the 20% that Medicare's Part A and Part B does not cover. And then that health insurance, depending upon what you have chosen, could have also premiums and deductibles. But yes, you can have both. It's just going to be when you're working, your health insurance through your employer is primary, Medicare is secondary, and then when you retire, it'll be the reverse. Medicare will be primary, and then whatever health insurance you carry into retirement will be secondary.
thank you, Jarita. Our next question, I know we covered in the slides, but it's worth repeating because it's really important. I never want people to be taken by surprise by this. Why is it necessary to sign up for Medicare at age 65? And if you don't sign up, is there a penalty? Their current insurance is covered by a spousal plan. So if they're covered by a spousal plan, is it necessary to sign up? I just want to double tap on the late enrollment penalty here, if you both don't mind.
Okay, so just as I explained in the response to the previous question, as long as you have health insurance through your employer or your spouse's employer, you do not have to enroll in Medicare Part B. It's when you retire is when we want you to enroll, and that's where you fall under the special enrollment period. But if you miss it, which is what we don't want you to fall into, you fall in what we call the general enrollment plan. So for every year that you don't take Medicare Part B after your 65th birthday, it's a 10% penalty that will be applied. So if it's 2 years later, for example, 67, you didn't take it when you were supposed to during your initial enrollment period, you're not covered under an employer group health plan through your employer or your spouse's employer, and you decide to come back and want to take it when you say 67, you can only enroll January 1st through March 31st. The coverage will become effective the month after you enroll. So if you enroll in January, it's effective in February, February effective in March, March effective in April. But just know it's going to be a 20% penalty applied to whatever the premium is for that year. And as the Dean stated, you'll be finding out shortly what the premiums are going to be for 2026. So I hope the information is helpful.
Thank you. Let's see. Our next question. Once you're enrolled in Part A, B, C, or D, is the annual renewal automatic, or do they need to actively renew any of the plans each year?
Dean?
Automatic. Well, A and B, that's something different. But when we're talking about Part C or Part D, because they're private health plans, when you enroll, it automatic. Though we very, very strongly recommend that every year you look at what they sent to you. It is a notice, and in that notice, they will tell you if there are any changes happening to your health insurance. So You don't have to change your health insurance, but it is highly recommended that you look at the notice to make sure, because every year, and I'm sure Chris is familiar with that, but every year we'll have someone who says, I used to pay X amount of premium, now it's doubled, or they'll say, this insurance used to pay for this drug, but no longer paid for that drug. Remember that they are required to let you know if there's going to be any change in your benefits. So when they send that notice, do not discard it. Do not ignore it. Read it and see if there are going to be any changes, and can you live with those changes. If not, then that's the part where during the enrollment period you can change. But no, it will be normal as long as you don't change it. But we highly recommend that you look at the notices.
Thanks, Adine. Our next question, can you apply in advance of losing health insurance benefits if you're going through a divorce?
I'm sorry, I didn't hear that. Could you say it again? It didn't come through clearly.
Apologies. Can you apply in advance of losing your health insurance if you're going through a divorce?
The only time you can apply for Medicare is based on the different enrollment periods, as I stated, which is for those who are 65 and older, when you're eligible during your initial enrollment period. If you are disabled, after being on disability for 24 months, Medicare becomes automatic, and it normally happens based on the date that you allege you became disabled. Next is anyone who has Lou Gehrig's disease. If you have Lou Gehrig's disease, you're eligible for Medicare. And last but not least, anyone who has end-stage renal dialysis or someone who's going to like a kidney transplant, you are eligible for Medicare. So those are our four eligibles, and you can only enroll during the enrollment periods, which was the initial, 3 months before your 65th birthday, 3 months after. If you miss it, you would only fall under special as long as you have special, as long as you have employer group health plan coverage through your employer or your spouse's employer. And if you happen to miss that opportunity, then the last would be the general enrollment, which is January 1st through March 31st. And it will incur a penalty depending upon the number of years after your 65th birthday that you decided to enroll.
Thank you, Jarita. Next one will be for Adine. You mentioned Part D and Part C have a service area. How can they figure out how that service area is defined?
Oh, the plan will tell you. And when we say service area, this is basically the plan saying that, okay, you're buying it in New Jersey. This is the areas that we cover. The plan tells you. You're buying it whatever plan that you're buying, it will tell you where they're covering you from. So it basically says, if you don't live in those areas and you needed it, unless it's an emergency, you need service, you use it, then they might not pay for it. But that's the plan. That's decide, this is the service, this is the areas that they're covering. So when we say you need to be in the plan service area, that's what we mean, because it's a network, right? It's a private health insurance. There's a network, and they decide what the network consists of. So that's basically saying be within the network.
Thank you. Our next one will come from Bruce. What about COBRA? Does this count as creditable coverage?
I think that's for you, Adine.
Okay. It depends, but in general, COBRA does not. It depends. It really depends, but in general, COBRA it's not creditable coverage, because creditable coverage means it's a group health plan, and COBRA you can purchase that on your own. Most of the time. So in general, no. So I would say, if again your eligibility is your eligibility, and we really want you to just apply for Medicare. But if you are talking about the time before you apply for Medicare, you're not working, you don't have a spouse who's working, and you need coverage, and There's are many things involved in that. This is not a simple question of saying yes or no. But in general, no, it's not creditable coverage, but that's the part where you would contact us and we will let you know.
Thank you. Jarita, I think this one will be for you. Lashana asks, what if you had a higher income in 2024 for something, for example, like a large disability payment? Jarita, can you talk through how you might be able to appeal IRMA payments and what they take into consideration there?
When it comes to anyone who's the, as we say, income-related monthly adjustment, that higher Medicare beneficiary, if you have a life-changing event, it's going to be a qualifying life-changing event. It has to fall under the categories of marriage, divorce, annulment, say it is the death of a spouse, a work stoppage, a work reduction, loss of income, reducing property, loss of a pension income, or employer settlement payment. These are the 8 categories that would have to fall in for SSA to give a determination as far as reducing your Medicare premiums back to the actual premium that's set for the year. So at least hopefully this will be give you options or ideas of the different categories that qualify for a life-changing event to reduce your monthly Part B or D premium.
Thank you. That's going to be our last question. We appreciate you both for joining us. While we're wrapping up here, I'm just going to share our office's contact info here and a couple closing thoughts. Give me one moment. So here is how you can contact our office. The number is 973-526-5668. We're also, like I said, we're going to share around a recording. We're going to share the slides from today's presentation. That will include Adine and Jarita's contact info if you have any questions. Please also keep in mind the SHIP line that Adine mentioned. This is a really, really good resource. We're going to include that for you as well, especially if you're looking at Part C plans. So we appreciate everyone joining us. I saw a few folks found this helpful. That's really good to hear. If you have any questions, again, we're here to be a resource to you. A reminder that the Medicare open enrollment period starts October 15th and ends December 7th. So please take a look at your coverage now and don't hesitate to reach out if you have any questions. Our office also gives casework services for any federal agency, even outside of Social Security and CMS. So if you guys are dealing with any issues with the IRS, veterans benefits, anything along those lines that's a federal agency, we're happy to help. Our final webinar in Congresswoman Sherrill's webinar series this fall is going to be on Tuesday on small businesses. So we're going to send that out just shortly. So if you're a small business owner and would like more information on those services, we look forward to hearing from you on Tuesday. But again, thank you to Adine and Jarita for joining us. Again, we hope this is helpful and hope everyone has a great weekend. Take care and have a great day.